my breast. What does that say about someone? So the information or the things we need to look out for are varied. There are many. But the important thing is that start early and then get to know your own body, get to know your own makeup. If your menstrual flow is 4 days, you should know it. Know that. Don't get to complain and say
when it extends.
Yes, and say, oh, and say how many days, I'm not sure. 4 or 5 or 6. No, you be precise. If they say, when was your last period? Why don't you have something on your phone or your diary or your calendar in your room that you can mark so that you can be exact? When was your last period? It was on the so day of so month. That's exact. So, and that kind of proper health monitoring, is what we need for women. I cannot begin to list the things that we need to look out for. There are so many.
Dave, you don't just relax and feel, oh, let me just. So you raise an alarm. All right, doctor. Thank you so much, ma. So there has been this disease about fertility. We are not so sure about it. I'm not a medical person. So we want you to enlighten us on it. So what exactly is PCOS? And probably the symptoms and every other thing that we need to learn about.
Okay, so the old name is PCOS. That means polycystic ovarian syndrome, and I feel that there's just been a lot of buzz around it in recent times because it's not the only, neither is it the most important, condition.
It's just recent.
Yes, how it is when people condition.
Just recent.
Yes, how it is when people just pick a topic and just go viral and everybody starts talking about it. And okay, yes, it's important to know, but it's not the only thing. So we shouldn't be alarmed when we hear it, and we shouldn't, be too anxious. Even if somebody has a diagnosis, it's not something that should make, you to be too anxious, because most things actually have good outcomes when they're properly managed, and treated right. So like I said, the old name is PCOS. The new name is polyendocrine metabolic syndrome. So it's now called PMOS. Okay, so and the thing about it is that it's not too common. Maybe about 10 to 15% of women will have it, and it's usually diagnosed somewhere around the start of the reproductive period, maybe around between 15 and 20. And then another period where people actually find out that they have it is when they're trying to get pregnant, because it's also a known cause of infertility. You understand? So somebody who has never tried, to get pregnant before, now getting married and now having a delay, one can find out. So those are the two periods where one can pick it up, and the symptoms will tell us why those periods are known as periods where you can find out. For instance, one of the symptoms is that the person will have irregular periods, so rather than having your cycle every month, which is supposed to be that way, the person could have skipped periods, and if one just starts, maybe around these days, young ladies are starting early, like 10, 11, they're starting their periods as early as that. So at that period, you don't expect a perfectly timed cycle. There could be some, skip periods here and there until the body now starts getting used to it, okay? So at that time, we're not worried. But by the time somebody has been menstruating for 3-4 years and is still having missed periods, and you're going to wonder. In fact, people start getting worried. Are you sure you didn't do anything? Why are you not having your period this month? That kind of thing. So, then, of course, for the other group that I said, may even be asymptomatic. Some people don't even know, and those are the people that will generally find out when they want to get pregnant. So they have regular periods, actually. You understand? So that cannot be the only thing that will be used to diagnose. So another thing that is common in them is that they have excessive hair growth. Excessive hair growth, I'm not talking about maybe hair on the, yeah, because that is genetic really. You know, like me now, my dad is like as hairy as anything, so I couldn't escape it. Having hair, so but if you now start having hair on the face as a female, you know, that's not expected. Or you have chest hair, or you have a distribution. If you look at the female distribution of hair, even on the stomach, it's different from the men. So if you now start having a male distribution, then that tells us that, you know, there are a lot of male hormones being secreted in your body. And that's one of the findings in PMOS, that androgens, which are the male hormones, you know, are being secreted in high quantity. Then for those who eventually get to do an ultrasound scan, they could see like multiple sacs in the ovary on ultrasound scan.
Doctor, you are taking us.
Yes. So you have to break it down. What information you actually, because many people actually have done a scan before.
As simple as possible, ma.
So I saw people nodding their heads. That means some people have done scans before, and the ovaries normally. So I'm going to try this. The ovaries normally will have a major follicle or egg. Let me call it egg, that will grow based on the supports from the female hormones that are being produced. And that happens every cycle. So when that happens, when it grows, if the woman and, you know, is in a family situation and wants to get pregnant, that egg that has grown big is going to be the one that will be released and could get fertilized. But we don't want more than one. I mean, the body does not need more than one. Because even in a situation of twinning, you know, it's going to be a situation whereby one is going to divide. Do you understand? So having more than one is not a situation that is helpful to the body, and it's not physiological. I don't want to say it's abnormal. It's not physiological. So a lot of the normal quantity of female hormones will not stimulate more than one. So when the female hormones are withdrawn, those male hormones are the ones that will be in high quantity, and that's the one that will produce many follicles as against the one that we need. Do you understand? Now, in addition to that, there's another area, and that's, I think that's the reason why they must have changed it from polycystic to polyendocrine. Number one, not everybody who has PMOS will do a scan and find more than one cyst. Because some people will have normal ultrasound scan. You know, I said people present conditions differently. But one thing is that there's usually an accompaniment of insulin resistance. And you know, insulin is not produced by the ovaries. Who knows where insulin is produced or is regulated? Produced from the pancreas. So that's another organ entirely. You understand? So you will find out that many people who have PMOS will have insulin resistance, and this will manifest in either them having high blood sugar at the extreme right. You could have people who are diabetic, and then many people, and falls in the middle, many people will be overweight. Okay? So it could be overweight ab initio, or the people just suddenly start gaining weight. And I've seen this quite, often, where maybe people get married and suddenly start gaining weight. And you know our culture.
You like, it's not taking it.
The husband has done well.
Taking it.
He's feeding you well. But in the back end, we know what something is going on that we don't want. So that's PMOS in a nutshell. And like I said, it's a contributor to about 15% of infertility among women, female infertility.
Thank you very much, Doctor. If you are just joining us, we are talking about the PCMOS.
PMOS.
PMOS. Thank you. So I'd like to ask, what is the cause? What exactly is the cause? Or how is it through lifestyle? Is it something that can be managed or?
Okay, so there's a very strong genetic component where PMOS can run in families. You have a lot of people who their mother had it or their aunt had it. And the thing is that we don't do too well in the area of medical family history or medical history. Once you ask somebody, they will not even allow you to finish asking the question that there's somebody in your family. Like, it's not my own family. We don't have such in my family, and they just cancel and cancel. No, now. So we don't really know. Many times we don't know what happened in maybe somebody's aunt or the big sister or the mother's siblings or even the mother, even the mother. Many mothers don't say what happened, what their own reproductive history was. Miscarriage. They don't say it. I'm sure many of us don't know. Like, I think I was probably, I know I was in my 20s when I found out that my mother actually had a miscarriage and would have been 9 instead of 8. You understand? I was when I found out. So you can imagine that if that had been as a result of something that could be genetic, I wouldn't know. So it's good to go back again and mothers were tell me about yourself. Tell me, is there anything in your own, that could benefit that I could know about? When you were having babies, she will manage on this. How was your pregnancy? When did you stop having your period? Because these are things that actually they reoccur. So for instance, somebody tells me, "Oh, doctor, when am I going to attain menopause? When am I going to stop seeing my?" I'm going to talk to your mom. It's going to be somewhere around the same period. Yes, something usually like that. So let's talk to our mothers. Let's and then talk to our daughters too, as they're growing up. So yeah, I talked about genetics, but that's not the only thing. In medicine, there are lots of things that we call things that don't have a known cause. So for PMOS, many times you can't actually put a finger on what it is. But lifestyle has been heavily fingered also because, we talked about the association between obesity and insulin resistance. So people who do not have a lifestyle of activity, physical activity, because insulin resistance goes along with sedentary lifestyle. When you're a couch potato, you sit down, and now everybody's working from home. So sit down on a station, and you're just there for hours and hours and hours. It's not even only about being overweight or obese, but the fact that we're not moving. So your muscles is the muscles that fight insulin resistance. So if your muscles are not active and you just have only fat cells, but you are not fat, then you're thinking, I'm saying all that is fat and it's not good. You're small and you don't have muscle strength. It could be dangerous. So lifestyle is also very important. And that's also one of the things trying to counter it in management. So we let them know you have to fight insulin resistance. You have to be more active. You have to lose weight if you're overweight. If you're overweight, you're told run, jog, swim, do something. That will make you do. And then we also give medication sometimes for those that might sense of them have high blood sugar. High blood sugar is not good for them, so we bring that also.
Okay. Thank you very much. So for our listener, Grandma, if in case the family question, the family will go for doctor.
tí n bá jókòó pẹ́ díẹ̀ báyà sí ti máa ó máa ń dra fún mi.
ọmọ ọdún mélòó ni ọmọ?
Ní August máa pé sí 59.
Iṣẹ́ wo ló ṣe lè bẹ̀rẹ̀ tó?
Ṣiṣẹ́ ìjókòó ni.
So you did not be a doctor. Like máa gbọ́ àwọn ìdáhùn wọn kárí pé àwọn nǹkan tó ti ṣe sẹ́yìn ó lè contribute sí complaint tó ní nísìn. Anybody who is sedentary, who is sitting, for a long time is definitely putting him or herself at risk of arthritis later on in life. You understand? And then her age too. There's some things that àwọn kankan wà tó jẹ́ pé a lè sá fún. Béèyàn ṣe ń dàgbà sí náà ni gbogbo ara náà ń dàgbà. Ṣó ti yé mà? Àwọn kankan ṣe mọ̀ pé ara yìí. So díẹ̀díẹ̀ ó ń fi hàn wá pé the time is counting, the clock is counting. Ṣó ti yé, but irú orókùn yẹn, it's arthritis commonly in older people. And one of the major causes is our lifestyle prior to old age. So you can see that this is one of the reasons why I said the knowledge is important even before you get there. Because you don't need to wait until you're till then. Because by that time, there's little that one can do. Nǹkan tá a lè ṣe, tá a lè sọ fún yín ni pé ẹ máa manage, ẹ máa lo àwọn oògùn tó lè relieve you. Then tẹ́ bá jókòó, ẹ máa kàn jókòó fún hours, 30 minutes, 1 hour every day. Ṣẹ̀mọ̀ kẹrin in the compound, walk around. And this is something that even younger people should be doing. Like I talked about sitting for hours at your workstation. Shouldn't be doing that. You should have like a timer or something on your device or your phone that makes you jump up. Once it's 1 hour, it will go. And you stand up, even if you don't have anywhere to rise, even our faith. You can put a timer that makes you go to the Bible when you see it and say, okay, my son put a timer for my eye drops. I have a timer for my eye drops. I have to take eye drops a lot. So take eye drops a lot. So he put a timer. So every time it goes, he put a timer. So every time it goes, I look for the eye drops, and I put it. So I will not have an excuse to say, oh, I didn't remember, or, something like that. All these things that God has given us, we should harness them and use them, for our own benefits too. Okay.
Thank you, Ma. You have done justice to the question. So let's go straight to the questions we have from the congregation. We have 3 questions here. I'll be starting with this one. During ovulation, I have the urge to have sex as a single sister. How do I go about this?
Okay.
Did you get the question, Ma?
Yes, I did. I got the question. And I don't know where the mother in the Lord went to, because it's not really much of a medical question. It's a spiritual question. Okay, yes, because those are physiological urges. Okay, yes, because those are physiological urges. They are normal. Because ovulation, the earth. I mean, how would it have been if during ovulation one feels, I don't want to see my husband? And many people will not have had children. Many people will not have children. Okay, what do I do? What should I do? I can go ahead. Okay. So many people will not have had children if during ovulation period you just don't want anybody to touch you. Yeah, So it's normal. So what would you do about it? So it's normal. So what would you do about it? I think one of the fruits of the spirit as a young woman and as a Christian is self-control. Abi, you must put your body under subjection, because you know that you're single, you don't have any partner, and as far as I know, what is available to the world in terms of self-satisfaction It's not something that God would want for us as children of God. So, since we know that, what do? We pray, buy ice cream, and God will bless your husband, keep him, your future husband, and, quickly we need to prepare him to come quickly.
Thank you.
Yeah.
Okay, the next question also talks about sex. I don't know. So, please, how true is this? Does the need for sex increases as you get older, as in 13 and above, especially when you are a virgin?
So I guess that means the desire, not the need, Abi. Maybe the desire. Okay. So I mean, I think I've answered it with the previous question. But again, libido means the desire for, sexual activity. Libido differs between people. In some people, it reduces as they grow older. In some people, it increases. But usually in women, it peaks around age 40, a little bit above 40, it peaks. And then from there, it tends to go down. For men, it peaks maybe around 50s, and then from then it goes down. So you find out that for women, many times they will have to accommodate their husbands. You understand? Even though they don't feel the urge, because looking at the ages that I mentioned, the age difference, women many times will have to accommodate their husband's desires just because it's their husband and you want to keep them. But yeah, so it differs in different people, and we should just ask God for the grace. Whatever our situation is, single, we can still be very happy and, don't feel as if that is the end of the world because you don't have a partner. There's so many things that one can use one's energy, to do. So convert that energy. Let's channel that energy into other things, that are productive, that are of good reports, and don't dwell. Another thing is that, focusing on things that have sex as a theme will continue to arouse such feelings. So you're watching movies, romantic movies, reading books that talk about my love, my that kind of thing. And you continue to whip up those emotions and those sentiments. So those are things that we should look at as well.
Thank you, Ma. 2 more questions and then it's a wrap. Doctor, please shed more light on hyprolactin and how it affects fertility. How do we balance our mental health as a wife, mother? Okay, and I'll come to that. I'm trying to get the second question. The first question here. Doctor, please shed more light on hyprolactin and how it affects fertility.
Okay, so prolactin is one of the hormones that is secreted at the center. And what I mean by the center is the brain. And it's a control hormone. And it has a feedback loop. The essence of prolactin is to tell the body to produce breast milk. Okay? When we have lactating on nursing mothers, prolactin says produce breast milk. Oxytocin says release the breast milk that has been produced. Okay? Now, when we have high prolactin levels, that means the body needs breast milk. Okay? And a body that needs breast milk, you see, your body understands, or your body knows, itself. I think that's the way I can put it. So that body that is saying, we need breast milk, prolactin levels, push up prolactin levels, we need breast milk. That body is also going to say, no ovulation. Because you cannot be pregnant now that we're breastfeeding. Do you understand? So that prolactin is also going to serve as a negative signal to your ovaries that is not the time. We're already busy. We're occupied with breastfeeding. Yes. So now, at the end of the day, when the breastfeeding has stopped, then you can now shift back to focus on ovaries. And that's why you find out that in newly delivered mothers, we tell them, as long as you're breastfeeding exclusively, to get pregnant. But if any of those is not there, don't come and say, doctor, what happened? Because I had a patient who delivered and came back for the 6-week visit, pregnant. Yeah, because she wasn't breastfeeding exclusively. She started ovulating immediately and she got pregnant. So her children are actually born in the same year. 2 children born, the one at the beginning of the year and the other one at the end of the year. Because she didn't terminate the pregnancy. She roughed it and it was rough. So that's what prolactin does. Now, if a woman who is not breastfeeding has high prolactin levels, that's an anomaly. And that's why you will find people who are not having babies or who are not breastfeeding having milky discharge from the breast, because the breast have been informed by that high prolactin levels to produce the breast milk, and that needs to be corrected. Because if it's not corrected, especially if you want to conceive, I've said it, you won't be able to conceive because the body feels that it's otherwise occupied. So we have to check the hormone levels, measure it, and when we find the value is elevated, then we'll do something to bring it down and say, no, it's not yet your turn. Wait, let's get the baby first, then you can now come. So we use medications usually to bring down the prolactin. Yeah.
Thank you, ma. So the last question. This is actually personal. Okay. Yes, ma. Let's have your question. We'll wrap it with this one. So this thing they call it doesn't have a time frame, or once it starts, that's how you have to manage it till death. And then I noticed, I thought it was a natural thing and therefore it comes anytime. But most time I notice in my own time, maybe I'm just sitting and someone just brings a news that hits me. It doesn't have to be bad news. It could be something that excites me. It could be something that just a news that is not the normal. Immediately the next day I find myself looking for my handbag or something to just do. So how can I manage that situation? Or is that how it goes? I say doctor, but actually I've complained to a doctor and they said, madam, at the age just hey, this age it did not happen to my mother. Why? And I remember the doctor now asking me about my marriage, and I told him I've been in this thing for 10 years, and so maybe you should look for a partner. So I'm not interested in a partner. So please, I don't know if you can. Thank you.
If you don't mind, ma, can I ask how old you are? Okay. Thank you. Thank you for that very vulnerable question. And rarely will you find people who are ready to share openly, but it will benefit us all. And thank you for that. Okay, so menopause is also a very important issue in women's health. And it just, is part of the spectrum. As women, we have one end when we have menarche. Menarche is the beginning of your period, and then the other end when you have menopause. And I feel that many times society tends to tie us to this reproductive period as if you are useful now when you have started having periods, and by the time you don't have periods again, and then they just toss you aside, but I think I heard it here. Did I not hear it here when I came in? Something about seasons or phases of life. Those are just phases, and God is not disorderly. He's not random when he created, us to have those particular periods in our lives. And every one of them can be utilized, for his glory. Every one of them can be utilized also for our benefit and for the benefit of people around us. So menopause typically happens, peri 50. So I would say, that means around 50. I would say maybe from about 45 in very early cases to about 54. You still have people menstruating up to 51, 52, 53, 54, But for those people who are menstruating during that period, we don't really want them to conceive, because the eggs that are in a female that she will have children with have been in her from the time she was conceived. You understand? So that means the eggs that will be present and being released around that period of menopause is very old. And then you have the tendency to have children who have developmental, congenital, or genetic abnormalities. You understand? So usually, I'm just trying to add a little to the conversation so that we can pick other things around menopause. So we usually advise that people who are around 45 and upwards, they shouldn't just think, oh, I cannot get pregnant. They should continue with their family planning, even if their periods are irregular. Yes, they may not be fully consistent as before. They may have one now, in the next 2 months, another one. And so continue with the family planning method that you have been using. Don't say, oh, in-law, you one can pregnant too. Maybe the person wants to deliver Obama or something. So in any case, menopause now, we start to say the woman is perimenopausal when the period starts to become irregular. So that's perimenopausal. Peri means around. So around the menopause period. And like I said, it can happen from any time from 45. Some people will have very early menopause in their 40s, in their early 40s. That is usually due to a hormonal problem. Okay? Now, those hormones that are being withdrawn, which is the reason for menopause, withdrawal of those hormones that usually support the development of the ovaries. Those hormones that are being withdrawn, they have their usefulness. They have their work in the body. They contribute to nice skin. They contribute to feeling of wellness, feeling of, activity, feeling good, feeling beautiful. They contribute to your tone, the body tone. So when those hormones are withdrawn, even they support parasympathetic activity like the heart rate, your breathing, things like that. They support the mucous membranes in your body have been well hydrated. So when they're withdrawn, all those things that they support will start to suffer from lack of that support. And those will be the symptoms that a woman will start to feel. Now, in very, very established and developed countries, we have what we call hormone replacement therapy. And some are actually available in Nigeria. It just depends on who you ask. You understand? There's hormone replacement therapy that helps you. It could be in form of a patch, a skin patch. It could be in form of a tablet that releases those hormones, but not as much as the body was releasing, but just a kind of maintenance level, so that you don't just, because people have gone into menopause and actually gone into full-blown depression, because they just don't understand how they feel. I told you that some of the hormones act to actually make you feel good, feel happy. So when it's withdrawn now, what happens? Person will be feeling sober and sad and everything. So we want women to understand that you don't need to suffer. You don't need to suffer. Talk to a doctor, talk to somebody. The person will walk you through, a good doctor A good doctor.
Good doctor.
Somebody that will walk you through the symptoms and try to identify. It could even be some simple supplements, that you can be taking that would change your whole outlook, change everything. It could be some exercises, For some women, they continue to have urinary tract infection because I talked about the mucous membrane. As you have mucous membrane, the lining of the mouth, you also have mucous membrane down there. And if it's dry, you can imagine if somebody is still married. If she was still married and then everywhere is uncomfortable, you're having urinary tract infection, you're having tears and all that. So one does not need to suffer, please. Then, like I said, it's a phase of life. Anticipate it. Welcome it, and be prepared for it. It's a time where, you don't have to start it. For me, I will share with you, I had surgical early menopause because I had surgery, and after the surgery, of course, if all the equipment is gone, there's no way you're going to menstruate again. I had to take out my ovaries, take out everything because of a particular medical condition. So that means, and I had that maybe around 44 or 45. What would I do? That means at that point, where I'm not even expecting menopause, my mother started menopause at 51. I was thrown into that. So prepare for it, anticipate it, ask God for the grace, and then use the opportunity for, just like we talked about being single. It's a phase. Use that. No need for menstruation again, and use it as a time for other things that you can be, productive in, and be graceful about it. For the issue of hot flushes, those ones, they will go. I had them severely because mine was immediate withdrawal of the hormones. Severely. I was always with fan. Even with fan, I'll be sweating. But, like I said, you manage it. Use light clothing. That's not the time to be wearing things that are padded and layered. Just work around what you have. If you have a portable fan, move around with it. In my office, there's a fan that everybody knows they must not move. On pain of death, if you move that fan, anything can happen to you because that's the fan that must be blowing me. So look for things to make yourself comfortable, and then maybe me and you can talk later on if there's need for medication. We can talk about that.
Oh, thank you, ma. So because of our time, we won't be able to take the last question. I can see raising your hand.
Just don't like it.
What do we
That
do?
means that's
Has
the
a
end.
question. Let's permit her. Yes, ma'am. Okay. The doctor will take it briefly. Yes, ma'am.
I have an observation. What can we do about this old age sickness? Why I'm saying this is that we have a doctor, family doctor that I've seen in the medical. Because when the NHI has been stopped with now, there was an issue I had to call him. By the time I called him, he told me he was having classes. I say, "Oh, doctor."
Doctor is human. The
I
doctor
said,
is human.
"Oh, doctor, God help us." Because the way things are happening now, nobody knows where we are going. And I pray God will be with us. So what I want to add with this, because if things like this continue to happen, I think we should go to God first, even before medical. Because the Bible says, "Seek first the kingdom of God and his righteousness, and other things are be added unto." Because I can't just believe it. A whole doctor, somebody that used to be active, very, very active, Then, probably nobody is benefiting. God will.
Thank you, Ma. So what Mommy has said is really the way many people think, and the truth behind it is that God is a God of principle. Your title, if you whatever title you have, if you don't adhere to principles, you'll be a victim even of what you preach. You understand? So many people actually talk, but they don't walk their talk. So if a doctor has been sedentary, if he, and you know, as we grow older, one thing I want to say to us is that as we grow older, we shouldn't lose our sense of purpose. For people, one thing I realized, because I have a whole, cachet of elderly patients, elderly people, I realized that those who go about their lives with a sense of purpose, they seem to age slower than those who, because we have a retirement mentality here that, oh, I'm retired. So once I retired, I stay at home. I don't have any. No. You must wake up in the morning and bathe. Have something you want to do. Have somewhere that you want to go. It doesn't mean that you're looking for stress for yourself. But that sense of purpose in itself, it makes your body produce hormones that will, give you energy, will energize you, and will even stem down inflammation. Then a lot of us are not sleeping well. Maybe also because of the phone. The phone has to die at night so that we can sleep minimum of 8 hours. Because that is what helps, and it's not just limited to the elderly now, especially young people. We're finding that young people are in sleep deficit. And sleep deficit is like poison to the body. It's toxic. You have to sleep 8 hours in the night. If for any reason there's maybe a period where this cannot, maybe you have examinations, something targeted, yes, we can understand that for that period. But once that is done, please know that your body needs to rest. When you enter your room, put off your lights. You don't sleep with lights on because your body knows that the lights are on. Your body knows the light, and then the hormones that are supposed to be released during the night, they will not be released because your body is seeing the lights. Growth hormone is one of those hormones that are released at night, and a lot of antioxidants. If you're sleeping in a lit environment, or every now and then you're checking your phone, you're giving your body signals that it's not yet night, and your body has understanding of a rhythm. A 12-hour rhythm where in the morning the light is on for 12 hours and at night it goes off for another 12 hours. So if you give your body feedback that light is still on at 3 a.m., it's going to go haywire. It's not going to understand. It's like mixed signals, So rest is important, a sense of purpose, and adhering to principles. If doctors say eat vegetables and doctors are eating things that are not vegetables, what will happen, man? The problem of old age will catch them. If doctors say exercise and they're not exercising, it's not by what you say, it's by what you do. It's not even by what you know. Yes. So thank you, ma'am. Thank you for that question.
Thank you, Doctor, for taking our time to answer all our questions. Please, if you have questions, you can write them. We'll pass it across to Doctor, and definitely she's going to give us a response. Please, let's celebrate Doctor. Thank you so much, Ma. We are so honored to have you. Thank you, Ma. Thank you, Ma.
Okay, ma, I'm coming. Please, I want us to appreciate Doctor. Thank you so much, ma. I really don't know how she combines all the things she does. She's a mother. Hey. You don't even know that she has 6 beautiful children. Yeah? One, you are crying.